This is a time of tremendous change in healthcare, and change can be really scary. But it's also a time of great opportunity for transformation.
Everybody's familiar with the problem of rising healthcare costs. The rising costs are a big challenge for the federal government, for state governments, for families and businesses. But what also needs a lot of attention are the gaps in quality in our healthcare.
The most tangible way to fix our broken healthcare system now is really to put the patient at the center and to actually meaningfully structure the team and the delivery of care around that patient.
Frontline workers in health have an enormous role to play, and when they are recognized and incorporated in a meaningful way in these teams, they become extraordinarily powerful workers.
So for example, at High Plains in Colorado, they have integrated medical assistants onto the care team to pretty high levels. They're using ratios of 3 medical assistants to every clinician. And with that sort of a team, they're able to provide much better care to their patients and increase productivity significantly.
We're able to provide almost 30,000 visits per year because we use nurse practitioners, we use physician assistants, and we surround our providers with well-trained patient facilitators and the health coaches so that our providers do only the things that nobody else can do.
It's a different approach to health care. These patients have to be involved and educated in taking care of themselves, and the staff needs to be able to provide that education. So in order for them to do that, they have to be trained on an ongoing basis. That is so important.
I felt great working at the Union Health Center and knowing that I was going to be able to do more than just medical assistant, that I was able to move up in a career ladder.
We're talking about having roles redefined in a way that helps everybody get their jobs done better.
Support is a very important piece of working in healthcare, and knowing that you have a team, so it's not just one individual, but multiple people who are all geared toward the same goal, makes a big difference in keeping your own motivation up.
In places like AtlantaCare, the team-based approach to care means relying on other professionals, including medical assistants as well as nurses, to deliver care.
There isn't a divide here between the MA and the doctors or health coaches. We all here as one. We respect each other. You know, we did it as a team.
In addition, they can provide a lot of services that just went by the wayside before because they were thought to be too expensive.
The point of it is that everybody on the team has a stake in each patient and a stake in the outcomes of that patient. So the team is there to help each patient get better, one patient at a time.
I knew intuitively that it would be a success, but it was not a proven concept. So because I'm a nurse by background, it just felt like if you did it right, you would get the outcomes you set out to do.
Sometimes people say that it sounds like it's too good to be true, but you can do this in any city in America, focusing on the patients with chronic conditions, improving care and reducing costs.